Hi, this is Brenda Page, and I am doing the video portion of our assignment for week 4 in Focus on Pharmacology. This week's assignment is to provide an assessment of what I feel like are a patient's problems or issues. A 54-year-old woman was found wandering in a park, and a jogger had passed by her and noticed that she seemed very disoriented. She was wandering around like she didn't know what was going on, so the jogger proceeded to call 911. Upon going to the hospital, she had already accused the jogger of stealing her cell phone. And now she has accused the staff at the hospital of stealing her purse. She is presented with bleeding, disorientation. She was very agitated, combative towards the medical staff. Her hands were trembling, were shaking really bad, and she was asking the medical staff to get her a bottle, like she needed a bottle of alcohol. Her clothes were completely dirty, and she smelled really bad, like she hadn't had a shower in a long time, and she reeked of urine in there as well. In my opinion, what I feel is wrong is that, one, she is an alcoholic. There's no question in my mind that she is dealing with that. She will experience, or she may, in addition to being an alcoholic, I feel like she may be suffering from a mental disease as well. And it falls in the lines of the schizophrenic spectrum. I'm leaning towards one of two possibilities. One might be that it's medication or substance psychotic or induced psychotic disorder, or the second one could be a schizotypal personality disorder. With that disorder, it kind of falls in line with her symptoms, where she's combative. She possibly is hallucinating. She's just trembling. You know, it's I'm not sure, but that's where I would lean towards it. I feel like her short-term issues could be things like, depending on how much alcohol she has, she's going to go through withdrawals. And she probably, with the trembling and the shaky hands, she probably already is going through some form of withdrawals. She's more than likely she's homeless. So in the short term, she has nowhere to go. She could face more confusion. She could face headaches. She could have she could deal with maybe even losing consciousness briefly. It's possible that she'll temporarily lose her memory, not remember where she is or what happened to her, how she got to where she is. She may even have blackouts that while she's still awake, but she won't have any memory of what's taken place. It'll probably short-term take her some time to regain her concentration and redevelop that aspect. The long-term effects could be a lot more severe. It could be coupled with some major diseases like liver disease. For example, cirrhosis. Generally speaking, once the liver is damaged, It can't be recovered. It will not repair itself. And that can ultimately become fatal. Yeah. She could experience stomach ulcers, or she could even potentially get cancer, which then in the end could be fatal as well. And she more than likely, because she is a drinker, she probably already suffers from depression or anxiety, and probably has for some time. So she's going to need to deal with that kind of thing. And she may even be going through something that's even more serious than just with the normal withdrawals from alcohol. She could be suffering from delirium tremors, which is, in today's world, they call it the DTs. It's a withdrawal, but it's a very, generally a person needs to be monitored with that. She needs to have treatment, and long-term treatment through medications. She needs to potentially initially be hospitalized to monitor, and a full assessment done as to which mental disorder that she may be suffering from. If or is it just alcoholism that has taken it and progressed very far. The problem comes into be, if she's homeless, she may not have health insurance. Health insurance is a big issue in trying to help patients with mental and or drug disorders. Most insurance companies have a plan in place to cover mental health, but it only allows for a certain number of visits. And there's some concerns about the deductibles. Is a psychiatrist, for example, a specialist? But a parity law in 2008 came into effect that says that mental health issues have to be dealt the same way as a physical issue, just like going to your primary doctor. So that has helped. I think insurance is good and it's in place, and outside of covering somebody or a person 100%, there's really not a whole lot more they can do. It's just a shame that it's that way, but I feel like it's a fair process, especially with the amount of mental anguishes and issues that people deal with today. So I think if she gets on track, I think she could face a great future. She just has to make that happen and want that to happen. Thank you very much for listening, and I will talk with you soon.